After heart surgery, whether it is bypass surgery, valve replacement, or any major cardiac procedure, the most common question patients and families ask me is, "Doctor, what should we eat now?" And I want you to listen carefully, because if this were my own mother, father, spouse, or sibling sitting in front of me, this is exactly what I would say, calmly and honestly, without fear or exaggeration. Food after heart surgery is not about dieting or deprivation. It is about healing the body, protecting the heart, and preventing the next cardiac event, because surgery fixes a problem but lifestyle prevents recurrence, and the heart after surgery is vulnerable, inflamed, healing, and sensitive to salt, sugar, unhealthy fats, and dehydration, which means the first principle I would tell my family is simplicity, simple, home-cooked food, eaten slowly, at regular times, with smaller portions, because heavy meals increase heart workload, cause breathlessness, and disturb sleep, and the foundation of every post-heart surgery diet should be vegetables, fruits, whole grains, good protein, and healthy fats, while avoiding processed, packaged, salty, sugary, and fried foods as much as possible, especially in the first 6 to 12 weeks of recovery when the body is rebuilding tissues, healing the sternum, and adjusting medications. I would tell them to start the day gently with a light breakfast like oats, whole wheat porridge, idli with minimal salt, or vegetable poha, paired with fruit like papaya, apple, or berries, because fiber helps control cholesterol and prevents constipation, which is very important after surgery since straining increases chest pressure. And hydration is equally important. Small sips of water throughout the day unless fluid restriction is advised, because dehydration can increase heart rate and cause weakness. And when it comes to protein, which is essential for wound healing and muscle recovery, I would emphasize natural sources like dals, beans, curd, paneer in moderation, eggs if permitted, fish if culturally acceptable, and lean chicken, while avoiding red meat and processed meats entirely, because they increase inflammation and cholesterol. And I would tell my family clearly that oil is not the enemy but quantity and quality matter. Use small amounts of heart-friendly oils like mustard, groundnut, or olive oil. Avoid reheated oil. Avoid vanaspati, butter, ghee excess. And absolutely avoid deep-fried foods, because even one oily meal can trigger acidity, palpitations, and blood pressure fluctuations in early recovery, and salt is where most patients unknowingly harm themselves, because salt hides in bread, biscuits, pickles, pappers, sauces, soups, and so-called healthy, packaged foods. So I would tell my family to cook fresh, taste food before adding salt, use herbs, lemon, and spices instead of salt, and remember that reducing salt helps prevent leg swelling, breathlessness, high blood pressure, and heart failure symptoms. After surgery, I would also address sugar honestly, because sweets are emotionally comforting after illness, but excess sugar increases inflammation, triglycerides, and weight gain. So I would say occasional fruit is fine, but avoid sweets, desserts, sweetened drinks, and bakery items, especially in the first few months, and alcohol and smoking would be a strict no, because they interfere with healing, medications, and heart rhythm. And then I would talk about timing. Eat every 3 to 4 hours. Avoid late heavy dinners. Keep dinner light and early, because digestion competes with heart recovery at night, and posture matters too. Sit upright after meals. Do not lie down immediately, and listen to your body, because loss of appetite is common initially and forcing food is not necessary, but nourishment is, and I would reassure my family that fatigue, taste changes, and reduced hunger are normal early on, and they improve gradually. And finally, I would tell them something very important that many people forget. Eating well after heart surgery is not temporary, it is a lifelong act of self-respect, because the heart has already given you a warning and a second chance, and food is one of the most powerful tools you have to protect that second chance, and if you eat with awareness, balance, and consistency, not perfection, you will heal better, feel stronger, breathe easier, sleep better, and live longer. And that is exactly what I would want for my own family.